Mr. Alexander, now that we are done with the questions, might you be willing to take a few minutes to talk with me about your drinking and drug use?
Sure.
Okay, all right. In looking at the questions, it appears that you're drinking about 10 to 18 standard drinks on a weekly basis, and that you have 5 or more standard drinks on one occasion on about a weekly basis.
Yeah, that sounds about right.
Okay, all right. And as you know or may know, that drinking above certain levels can cause problems, such as not being able to do what's expected of us or feeling a little bit guilty about one's drinking.
Yeah, I've definitely been there before, so.
That sounds about right.
Yeah.
Okay. And I'm concerned about your drinking and drug use. Your score on the drinking questions was a 10.
What does that mean?
Sure. A 10 places you at the medium level for drinking. So your results show today that you're not in the range associated with an alcohol use disorder, and at the same time, your results show that you are experiencing a medium level of problems related to drinking.
Okay.
Okay, you're trying to take
Yeah.
take this in.
Yeah, the whole medium level thing is new because I don't really look at this as a problem. You know?
Okay, sure. And with the drug questions in regard to your marijuana use, that score was a 1, and that's at the medium level as well. So today, for drug use, your results show that you are at risk for experiencing a drug-related problem or problems related to your drug use.
I mean, I really only drink and smoke to relax. It's not a big deal, you know.
It's surprising why we're talking about
it is. It's kinda,
about this to
yeah.
you. Yeah, okay. And if I may, these are what are considered to be low-risk drinking limits for men based on your age. So no more than 4 standard drinks on any day and no more than 14 standard drinks per week.
Wow. Yeah, that's crazy. I've never seen anything like that before.
Okay. These limits seem low to you.
Yeah, they are. I mean, like 4 sometimes just gets me started into the night, so.
Right, and a lot of people have that same reaction, that these seem low. It's all new information.
Yeah.
Okay. When we look at this ruler here, on a scale from 0 to 10, how important might it be to you to change something about your drinking?
About 5.
5?
Yeah.
Right in the middle?
Yeah.
Why a 5 and not a lower number?
I mean, I suppose there are a couple of things that, I could change. The amount in which I'm drinking, maybe. And maybe find something else to relieve my stress.
Okay. All right. Put something else in your life in terms of relieving stress, finding ways to relax.
Yeah.
Okay. What's the next step for you then?
Well, figuring out, I guess I never really paid attention to how much I was drinking at a time. So I guess cutting back. Well, does this also mean I can't drink on the weekends a lot too, or?
Well, it's certainly up to you. And what it means is that if you were to stay within these low-risk drinking limits, that you would be less likely to experience problems or further problems as a result of your drinking.
Okay.
Okay. All right. So you're wanting to, or you're thinking about ways in which to stay within these guidelines.
Yeah.
And it's important to you to find other ways to reduce your stress, to have other ways in your life to relax.
Yeah, I mean, it's really important too because, you know, my family has a lot of health issues, so staying within that range makes more sense to me.
You want to stay healthy, and you want to stay healthy and take steps to do so.
Absolutely, yeah.
Okay. And before you leave today, we have some handouts that we give to everyone here at the clinic who comes through. And one of those handouts has this diagram shown on it in terms of the low-risk drinking limits. Some people find that one in particular helpful to take with them.
Okay.
Okay. And if we could schedule in a couple of weeks just to touch base and see how you're doing.
Yeah, sure.
Okay, that would be great.
Yeah.
Okay. Thank you very much for taking the time.
Well, thank you. I appreciate it.
Thank you.